Welcome back to Beauty Marks Podcast. My name is Elizabeth Savion, and thank you for joining me on another episode. Here we talk all about healing, cultivating community, and embracing our story. And if you haven't already, make sure to subscribe to this podcast and leave a review. All of that helps us to grow this podcast. And I wanted to read a review that someone left recently because I just love reading them. And we are trying to get to 100 by June. So that is like a free gift to give, to be able to share and be able to share what you guys are loving, because that also helps us when we're creating the content. So the recent interview says, I went into a deep dive as I'm struggling to navigate my relationship, and this has been the most validating podcast and helps me feel heard and seen. So thank you so much for that review. When I've done this relationship series in the past 2 months, I feel like I have gotten a lot of feedback on that, of a lot of people that resonate. But really, this is for you guys to be able to just relate. And I was talking to my guest before this of like trying to make things more personal and just feel less maybe stigmatized or feel like you're the only person that is going through something. So that's a great segue into my guest today, which she is an amazing doctor. So Dr. Marcelline Girlie, welcome to the podcast.
Thank you for having me.
I'm very, very excited for this conversation. So she is a telepsychiatrist, correct? Is that how you say it?
Well, I'm actually a dual certified family and psychiatric mental health nurse practitioner.
Yes.
So, yeah.
Yes, but she really specializes in all things more on the medicine when it comes to our mind and our mental health.
Yes.
And so I have not had this kind of conversation before, so I am also going to be learning a lot from you today, and I'm just excited to hear more about what got you into the work that you do today.
Well, actually, it started in just working in family medicine. I was working in a practice, and all I saw were issues with the way people thought, the way they lived their lives. Anxiety was permeating everywhere. Moms had anxiety, dads had anxiety. And I went into actually caring for all the kids because everybody was afraid of children in family medicine. So I went into caring for all of the kids, and I would see different things show up as a physical issue, like anxiety as a headache or tummy ache or school avoidance, having nausea, vomiting, and all of those things were actually root cause in a mental health issue. And of course, in children, we also have hyperactivity, so there's a lot of concerns with concentration and movement from the teachers, complaining to the parents, and the interest just got bigger and bigger and deeper and deeper. And I found that I wanted to go back to school, and I did. And it's been my niche ever since, just connecting the mind and the body and the spirit, and knowing how that all works together for our overall well-being.
Yeah, I love that because I feel like it seems like you tapped into one area and that led to something else.
Exactly.
And have you ever had like mental health issues? Like, is that more personal to you as well?
Actually, I love to share that. I actually was diagnosed with ADHD in grad school. So I struggled with a lot of anxiety in undergrad and in high school, just a lot of perfectionist issues. And I would notice that I would study and feel like my mind went blank. And it wasn't that I wasn't smart. It wasn't that I couldn't retain the information, but I had anxiety when it was time to take the test. And with a Caribbean background, I'm of Haitian descent, my parents didn't believe in me having some sort of a, concentration issue.
Sure.
And they're like, her behavior is great. I used to get in trouble for talking too much here and there, but I was always done with my work first. So boredom was a big deal. And so I was that girl that was pretty much coping with all of the index cards and the extra planners and all the extra tools. My father made sure I had them all. I had all the ringers and timers, everything. So I used that as a crutch and a way and a coping mechanism throughout my academic studies. But in grad school, it really just piled up. And I will never forget, my professor was like, listen, something is going on because you, in the middle of an exam, have to go to the restroom like 500 times because of anxiety. And I think she was assuming that I was cheating in some way.
Yeah.
So I took her advice and I went and see the school psychologist, and he assessed me and he sent me to the psychiatrist. He's like, listen, you've been coping so much, you have no idea that you have ADHD, and that's what's causing the anxiety.
Yeah.
I would pray things off, right? I'm like, I'm going to remember this. And, you know, I use my faith a lot to help me. But it became a burden. And I won't forget when he wrote me that prescription the first time I took it, the first day, and I was like, thinking my personality was going to change or whatever. But within like a week, I was like, this is how everybody else thinks? Like, you don't have 5 million ideas at the same time, or you can sit and study for an hour and not feel like every 5 minutes you're distracted by something. Wow. You know, and
it's like a whole new world.
A whole new world for me. And it was interesting because I never thought of it that way, you know, previous that I actually needed medication to help me. And so it's kind of like full circle that I'm working in this field now. And the second episode for me was having postpartum depression with my son, and didn't even know it until later. You know, he was born premature. There was a lot of health things, a lot of scares, and I was alone for a lot of the time because my husband was traveling. And it wasn't until a friend came over who is a therapist, and she said, listen, you're struggling. And it hit me, even as a prescriber or a clinician, that you actually do have this, you know, and you didn't want to say it. I didn't want to say it out loud, you know.
Because you felt like maybe it's like a weakness having that.
Correct. And not realizing there's a lot of hormones, a lot of movement. Your body, it takes at least a good 2 to 3 years post having a child to fully heal and get back to itself. And when you don't have the initial support within that, you know, 12-month period, you can fall into a slump, you know, and it's not because you don't love your child. It's not because you're not happy. It's the fact that there is a lot happening, and you are, you know, I like to say upgrading yourself because you've added such joy and happiness with your child into your life, but that's an added stressor, and you may start getting a little dark and a little irritable, withdrawn, and just, again, having a great friend who identified that for me. And it helped me to, you know, seek therapy immediately and get myself back, you know, into that positive train of thought. So
that's so important to have. And we've shared episodes before of other people sharing from like postpartum, or the importance of like having that support group during those times, because sometimes you miss it. And I want to go back to something that you said, because I know a lot of adults, and I know some people personally that have gotten diagnosed with ADHD as an adult. So they're like, this my whole life I struggled and I didn't know what it was, and now it makes sense. And there is a big stigma in that, you know, and there's also some kind of like, I should be smarter, I should be able to like work through it. It's all mental, you know, that's what everyone tries to like force on you. Like it's all just like mental toughness, you know, but it's like some things you do need medication for. And sometimes it's temporary, or sometimes it is just something that's going to help you live your life actually in full joy and full like complete accepting of how life is.
Exactly. And one thing about ADHD medication that I want people to know is that you do not have to take it every single day. As for myself, when I need to concentrate, that's when I do need to take it. I know those days. I know my schedule. And it is, I laugh about this because my husband would say, it's like your super pill, because I know when you've taken it and when you have not.
He's like, this is we're doing good.
You know, and it's not a hindrance, you know. And I tell my patients, particularly my children who are coming in and are beating up on themselves because they can't concentrate, I'm like, use it as a superpower. Just know that you have some amazing ideas, and they're all trying to just come out at the same time. But let's get them in order, right?
For sure.
So you can be more successful.
For sure. And like, that's a good segue into maybe, can you explain like what's the difference between a psychiatrist and the work that you do and why it is important, aside from maybe talking therapy?
Exactly. So when people look at the psychiatric field, they automatically think about psychiatrists, which is exactly what, you know, has been in the field, but now the field has evolved and expanded in so many ways. When you talk about a psychiatrist, you're talking about like an MD, which is a medical doctor, or a DO, which is a doctor of osteopathy, naturopathic medicine who went to school, 12 years and such, residencies. Their focus is pretty much diagnosing, treatment, and ensuring that patients' safety and their needs are met. Then there are individuals like myself who are psychiatric mental health nurse practitioners, where we are not medical trained, we are nurse trained. Our background are in nursing, so we go from everything from having your bachelor's in nursing, master's in nursing, to what I have, which is my doctorate in nursing practice, and we specialize in psychiatric mental health, right, where we manage, we diagnose, we test, and we treat our patients just like the psychiatrist would, but within our scope of practice. When you see the psychiatrists, they are at times, let me just say this. We can actually take care of complex patients, but the most complex patients, we want them to be seen by a psychiatrist. And we are in different states supervised by psychiatrists. And so that's the difference between a psychiatrist and a psychiatric mental health nurse practitioner. Nurse practitioners can also provide psychotherapy, which I do if I'm prescribing medications to my patients. And then you have your therapists and your counselors, which is your talk therapy, and that's their job to help you file your folders, your emotional folders, and get your thoughts in order to have a more productive life.
Yeah. And what would you say do you see the most in your field of what are the type of mental health either conditions that you see?
I see everything, to be honest, from anxiety to depression to ADHD, like we spoke about before, different personality disorders and stress-induced disorders and thought processes, lots of acute or chronic post-traumatic stress. Disorders from having some sort of a trauma impact. I would say psychotic disorders, like your schizophrenia, schizoaffective, or bipolar. So the entire range of different diagnoses is what I see.
And what about in your 20s and 30s? Because I feel like a lot of people don't get diagnosed with get either misdiagnosed or they don't get a diagnosis until later on in life. So what do you feel like you have seen the most in 2024?
So honestly, it's about the same, right? Because at this age, they're young adults. They're trying to get their life started, trying to identify who they are, what they bring into the world. All that can bring anxiety and or depression. Yeah. And within that 20 to 30 age range, we would get individuals who are having their what we call first break or first manic episode. It happens between that 25 to 30 year, mark, sometimes younger, but typically within that. But I have to say a lot of the patients, or a higher percentage of those individuals, are anxiety and depression, which is their first symptom, not necessarily meaning that is the entirety of their diagnosis, but anxiety and depression seems to be something that they're coming in for the most.
And that's the first kind of check engine light. That it's Correct. I've been like this for a long time, it's starting to affect my life. And so when someone's okay, how do I even start to manage that? Yeah. How is that process? What do you get when you're starting that process with someone?
So they come in, they make an appointment to see me. They come in for a psychiatric evaluation where we pretty much talk through the symptoms that you are presenting with, how it hinders or impacts your life. What does life look like every day for you? And why do you feel like this is the right time to get treatment? I always want to know, why now versus having it done later or earlier in life, and also wanting to know how you want to be treated, right? Some individuals come in to see me, they do not want medication, but they are more lenient towards vitamins and minerals.
More holistic.
Very holistic in their approach. And then there are those who are no, I know what I need and this is what I'm going to get. And they're also a class of individuals that either myself or them realize that therapy is the most effective tool for them at that time. Although even though I'm prescribing medications overall, I tell my patients that, listen, it's not just medications, it's what you do with your thoughts that really help the bigger picture. So I often, very often, referring my patients to see therapy as well, because I don't believe in just one-sided, treatment modalities. I do believe in us creating a collaborative team of nutritionists, of therapists, your physiologists, people to work out with, and support groups. It's an all-around thing. It's not just one-sided, just getting a pill and popping it and thinking your day's going to be brighter. Doesn't work like that.
Yeah, and if I'm honest, so in 2019, I was diagnosed like clinically depressed, and the first thing was you should get on some medication, but then like the commitment of the medication, like you can't just start this, like you have to commit through and like hear all the side effects. And I'm gonna be honest, I was scared. I was like, no one in my family has ever done this. I don't know how this is gonna be. And so I didn't do it. And maybe at the time I needed to. I ended up doing more on the therapy. I did EMDR, which helped me a lot through my trauma. I was in community groups. I kind of went a different route that was helpful to me. But I know that there are cases that do need it. And can we talk about a little bit of the cultural aspects when it comes to our mental health? Like, what do you see that kind of hinders people from getting their own healing or to work through because of those narratives that you say about mental health?
Culture plays a huge part of who we are, right? Where we come from plays a huge part on how we live our lives in general. So I'll have patients come in and say, hey, listen, I don't do medications. I do herbs, and when you ask them the type of herbs, I'm like, well, those are more like, your fun herbs there, it gets you lots of euphoria, but it does not completely help, with dealing with what's going on internally. So respecting that, that's part of their life. I mean, again, I'm of Haitian background, so we are always looking at teas and tinctures and oils and everything. And I incorporate that into my care, but I also realize that treatment is not linear, right? I can try a little bit of everything and get the combination that is most appropriate for me or for my patient. So with culture, I have to step back and really let them tell me, what that looks like. Most of the things I hear is that we don't do that. We don't do medicine. That's for people who are quote unquote crazy. And I really try not to ever use the word crazy because I feel like it's just has a negative connotation from the beginning, right? Just by the spelling of the word by itself. So I tell my patients that because you take a medication doesn't mean that you're crazy, but you're seeking to be stabilized, understanding that you're not within your normal scope of yourself or your thought processes, and the world can see it. And we want you to put your best foot forward in the world, removing the fear of other people and understanding too, this is a private encounter with yourself. Accepting yourself for where you are. This is not up for public discussion, right? This is me saying, I am going to upgrade my mind, my life by stabilizing myself and taking care of these internal things that are occurring. And the world doesn't have anything to say about that. And that world also means your family. Right?
That's hard.
That's very hard. That's very hard. And so I often have to educate families and cultures. I have different backgrounds. I have people from Indian backgrounds who don't ever do medication, Hispanic backgrounds who, it's a lot of spiritual approaches. Again, Caribbean background. Again, we're teas, tinctures, and oils. That's what we do. So all of that put together, I have to step back and allow them to tell me how they want to approach this. And tell them, hey, it's okay to have a conversation with your family and let them know, I know where I start and where I end and where you begin. And right now, this pill or this medication, you're not taking it. I am. So will you support me on this journey, no matter what that looks like? Because I'm just trying to make sure that I'm internally well, and mentally strong. So.
Yeah. And I think that's also important to find those people that do support you in your mental health journey. Because I feel like sometimes, and even I was one of the first people within my family to even go to therapy to start that journey and process. And I definitely felt like I was one of those, like, the pioneers of, like, we're going to do this. And it was not easy because it was so many, like, opinions and so many, like, things that you kind of felt a lot of shame about. Or you were like, who do I talk to about this? Like, and not seem like I'm weird or if, like, are my thoughts normal or the process that I'm going through, And I think that it was important along the process to find that support group and those people that are gonna like encourage you throughout your journey of like your healing, like mental health. And there are some people that maybe it's not the best to share with, you know, until you're kind of stabilized or like kind of have a flow with it, because then that can also skew or change your opinion or change your direction, because you're like, I shouldn't do this, you know, because, you know, my mom said this, or, you know, and I know culture and then generations have to do a lot with it. I love my grandmothers, but if I told them that I was depressed, they would be like,
for what?
For why? You have a roof over your head. You have food on your table. Like, you just need to get out there and work. Like, the more busy you are, you don't have time to think about your problems. Like, I'm pretty sure we've all heard that from someone that, like, you know, or even sadness or just different things. It's kind of like, or I had it worse. It's like, oh, you have no idea. Talking about trauma.
Yeah.
And they tell you like the same story they've been telling you your whole life. Yeah. And you're like, all right, mine is not valid. So how does someone deal with that? With like generations and mental health?
Well, again, you literally have to tell them, this is where I end and begin. And you're outside of that.
Yeah.
You know, from my head to my toe, this is me.
Yeah.
And this is my life experience. I understand that you were able to cope with it in whatever facet or way that you coped, right? Unfortunately, I'm not you. And you're not me.
Yeah.
And it's okay to have that opinion. But I'm going to do what's best for me.
Yeah.
And honestly, when we start telling people, like, this is the boundary, and you're trying to cross, you know, when I say from my head to my toe, there's nothing else attached to me. This is your boundary, and you're going to have to keep the opinions to yourself. Yes, life for you may have been hard. It was a different time for you. Maybe the way that you process and your perspectives are different than mine. And if I feel like I need assistance or I feel like I need support, then that's what I need, because I evaluate myself and my needs daily. And I'm going to get what I need. If I'm hungry, I'm going to eat. If I'm thirsty, I'm going to drink water. You don't tell me when I'm thirsty. You don't tell me when I'm hungry, right? I have to tell you. So I need you to be over there.
Yeah.
And it also brings the absolute opportunity to educate them. That was a time that you were able to cope with this, and these resources may have not been available, but they are now.
Yeah.
And I'm going to take the opportunity to get the help that I need.
Yeah,
you know?
for sure. And sometimes you're like, can actually you be in therapy?
Yeah.
That would be
And half the time they need it. They need it. It's just the fact that they didn't know that was a thing, you know, and a lot of cultures, including my own, like, what's happening in my head, in my home, stays in my head or in my home. And that's why a lot of trauma has been passed down, you know.
And stored in our body.
Yes.
Because then health issues, and I've learned so much about that, like how things that we keep on the inside, like how you're saying a little bit earlier, like start showing up in our life through other ways. And then you're like, wow, like I've been so healthy, whatever. And then it's like, yeah, but you have a lot of resentment, or you have a lot of trauma you've never told anybody about.
Correct.
Or you have so much, just so many things within ourselves that we're holding, that our body starts releasing toxins, starts, you know, and you know more about that. So what are maybe some ways that someone can say like, wow, I've been storing this, and these are like, this is when I do need to start paying attention to it?
Well, that's where that self-awareness comes into play, being aware of who you are, where you want to go, and what's hindering that. What no longer serves you that you need to let go of. Because if you don't let go of it, it's going to fester. It's going to mold. It's going to become toxic for you. And I often try not to use the word toxic, because we've now overused the word and desensitized it so much, right? But it's the appropriate word for this conversation. But literally just looking at, what are my needs? What are my needs? That's it. When it boils down all the way down to that. What do I need? And nobody can tell me what that is. You know, and culture can't tell me, friends can't tell me. What do I need?
Yeah.
I have to just accept that.
Yeah.
And use what I have, you know, to care for that.
Yeah, because some people have never really sat down and thought about, what do they need? What do they feel? What do they maybe like have as a like that's hindering them from going somewhere else.
Mm-hmm.
Like, and then you're like, man, like I've been doing this, but then every time I end up like going back, or every time I end up like talking myself out of it, or then I start feeling like you start kind of realizing your own patterns within your mind, your life, and your body and things like that. And that's when you're like, I actually need help.
Right, you need help. I'm getting these headaches because I'm so stressed out. You know, I have severe stomach issues constantly. I have lots of anxiety about things. I can't sleep at night, which is big. You know, most of Americans have difficulty sleeping.
Yeah.
You know, and it's because of stress. And the body keeps score of everything that is done to it.
Yeah.
You may not want to talk about it, but it'll let you know about it later, and it's going to show up. You may become angry on the job, and you're losing jobs, and you're like, well, it's the job, it's not me. No, look at the behavior pattern. There's something deeper going on here. It's not every single company that has the same issues. We have to actually take an internal look and perspective of ourselves. Look in the mirror, you know, like Michael Jackson. Let's look in the mirror and really try to pull at, man, maybe I'm responding harshly. Maybe I am quick-tempered, you know, or people are calling me a hothead. You know, I'm constantly getting into fights and arguments. What is that all about? Or maybe you're in a relationship and you just have outbursts, you know, towards your family or children, and everybody's being affected. It's time to look in the mirror. It's not the people around you. It's you. And I like to tell people that if it shows up in more than 2 settings, it's not the people. It's you. It's time to look in the mirror and just get some help.
Yeah. And that's the hardest part. To actually recognize of like your own dysfunction or things. And I've shared on this podcast before of like even things that I've gone through of like, you know, certain relationships, certain patterns that I had, and having that like process of like, yes, it was a very dysfunctional place that I was in and I came from, but it was also things that I was taught and that was normal to me to live that way. And then I was like, wait, no, this is not okay. And I'm actually enabling certain behaviors, and I'm actually like adding to the dysfunction. And that was hard. But then you realize also like that you're also so much in control of that. You have more power than you think you do.
Yes, you do.
And even like over your mind, over things like that. So for someone maybe that feels hopeless of like, well, this is just how it's been. Like I've struggled with this my whole life. Like what can you say to someone that maybe feels like that?
Well, if you're feeling like that and you can actually verbalize it, I always say this, get another person's perspective. There's always hope. There's hope around the corner. There's hope walking to the bus stop. There's hope getting in your car. There's always hope. There is someone who's smiling at you, complimenting you. Those are hopeful moments, right? Every moment that we get to breathe and take a breath, there's another day for hope. So one thing about hope is help. You have to look around for what the helps are. Where can you get help? It could be with your employee support system, right? Tapping into the free therapy and counseling that is available through your employer. There's hope when you go to the primary care doctor's office. You went in there for your annual checkup, but they scan for depression and anxiety, and it shows up. And because you have a connection with your primary care provider, I hope you're able to tell them that. And they can instill hope by referring you to someone else, or maybe even at times prescribing something that you can start on just so you can, you know, see how you feel on it and be referred, you know, to see a specialist in some sort. I feel like hope is like our breath of fresh air every day. It's an opportunity. It comes every morning. And the point is, you have to plug into hope. You cannot think that you're going to get anywhere without plugging into hope every morning.
I love that. I love that. And I love how you also mentioned about that sometimes those little like windows or people that are put into your life to be like, hey, like maybe check into this. And, you know, because maybe people can't solve always your problems, but they can offer solutions or support. And at least with like medication, which I know that I want to like dive back into that of like, what does that look like for someone that maybe like stigmas that are there, and what does it really look like? What is it really for? Well, maybe someone's like, I don't need them.
Right. So that's a pretty tricky question, because that's based on case by case, right? But I'll just say in general, when someone comes in and sees me and are concerned of let's say, example, anxiety. I want to know what's the root cause of your anxiety. Is it related to family? Is it related to trauma? Is it related to work? Like, where is the anxiety coming from? And how does it affect your everyday?
Yeah.
And how I determine, and of course, we have lots of screening tools that the patient will go through with myself as I'm questioning and interviewing them, as well as on their own. I want to see their responses, their internal responses. And as they're answering these questions and are really taking a bigger look of how anxiety affects their body, right? Muscle aches that come out of nowhere. Again, headache, blurred vision, and they never had that before. Change in taste or change in appetite where they don't eat at all because they're so anxious. I'm looking to see if this symptom is it hindering your everyday? Is it causing you not to enjoy life, enjoy your friends, see the brighter side of things? Is it causing you to withdraw from things that you used to love to do and you no longer have even an interest in? Because you have this really deep-rooted fear that has no basis.
Yeah.
Right? Because most of the times those individuals with anxiety have no basis to why they are afraid. Because typically anxiety is it's like a danger response, right? There's danger, there's harm coming your way. Flee, run. Like if you walked into your living room and there was a big, massive alligator here in Florida, we have those sitting in your living room. I hope you don't walk over and just pet the gator. I hope that you like, get out, run,
fight or flight,
get out. But those individuals who are having anxiety, they're in a constant place of fear, even while cooking dinner or talking on the phone or driving or going to work. So I'm constantly looking at how it impacts your everyday life.
Yeah.
And then we're going to talk about that. What do you want to see different? Right? What do you want to see change? And I engage my patients in that way because I want you to be in control of this. I'm not in control of your responses to the medication.
Yeah.
I'm not in control of your day-to-day because I can write as many prescriptions as I want. Doesn't mean you're going to take them.
Yeah.
So I want you to partner with me, right? And I partner with you in making sure we make the right choice. And as we talk through the medication, because there's, a lot of them to pick from, and I'll tell you why I picked this one and why I think it's appropriate. But I also tell you it's not the tell-all be-all. Okay? And that does not guarantee that you won't have some side effects. You may have some nausea, some headache. You may have these things, but this is a time frame of how long those should last. And let's not quit prematurely because you don't like the way you feel the first 2 days.
Yeah.
Giving your body the 6 to 8 weeks that it needs to kind of just settle in because it takes the body that long to get the medication where it wants to go and needs to go.
Oh, wow.
Right?
I have heard, maybe you can explain this. Do you usually do the genetic testing, and can you explain that?
Oh, I love genetic testing.
Okay.
I used different companies for that.
Okay.
But pharmacogenetic testing within the last 15 years have become more popular. And typically what insurances want is that you fill at least 2 to 3 or even up to 4 medications before they will actually cover it. So that's why it's so expensive. So you can't just say, oh, I want that test before I even try a medication, because of course that's just not sound decisions or the way to go. Although sometimes I do have patients that are like, why would I want to be a guinea pig? I want to go straight to the medication that will work for me.
Yeah.
But again, before that, we had to go through all the medications or whatever. But just trusting your provider to make the best choice or the best recommendation for you. But I love pharmacogenetic testing because it gives me, again, not the tell-all be-all, of tests, but it tells me, hey, genetically, this individual will respond to this medication based on this pathway and how to use it. A lot of the tests will tell us, that to be more impactful, they need less dosages, a lower dose, or they need a higher dose because they're a faster, slower metabolizer. And they'll also tell me, like, your MTHFR, do you have a missing link in that? There's a gene there that may hinder how you absorb medication if you absorb it,
Oh, wow.
So those tests can get quite complex. If you ever see a report, there's a lot of dots and colors, and it can get really confusing to the, the uneducated eye. But us as professionals, when we look at it, we decipher. And again, it's not the tell-all be-all. And there are some providers who don't believe in it at all. I always say, give science, an opportunity to showcase itself as science, right? And we're all in the practice of healthcare or the practice of medicine, so nothing's, perfect, the practice of nursing. So allowing the test to be a great tool, and I've found lots of success with my patients, who's been on 6-7 medications, maybe at the same time. And because of side effects or concerns, they quit all of them and felt like nothing worked, right? Yeah. And we go through this test and we're like, okay, let's try this by itself. Or let's try this with a supplement for a missing gene or whatever that you have, metabolism issue. And it's like a light bulb goes off and that individual is so stable and it's so beautiful to see their recovering. So I do love pharmacogenetic testing. I think it's amazing and it needs to be utilized and accepted more as standard.
And I think that that's a great way of someone that maybe, like how you said, that is like, I'm not sure. I've had multiple cases of being like over medicated. And I was explained to this recently of like sometimes from a hospital, right? Or like people give you a whole bunch of medication and that's a whole nother conversation of that. But sometimes you don't know that all those medications have side effects that are affecting each one.
Oh, yeah.
And even I know like my grandparents, they take a whole bunch of medications that then they've had to go back because like no one really does the research of like figuring it out for them. Like, oh, this one's causing this and this is causing this. And so I feel like with the work that you do in a psychiatrist, I feel like what I'm understanding is like that's even more specialized to make sure that you're taking the appropriate amount that you need.
Right. Well, what you just actually explained is polypharmacy. And the older you said your grandparents, the older we get, we have a tendency to see multiple specialists, right? And those specialists are not necessarily talking to each other. And at times, those individuals don't even know the medications that they're on. They're like, oh, I'm on a pink pill, the pill with the blue mark on it, or the 12, as a marking, or 8. I get that all the time. I've had patients come in to see me with bags of unmarked medication. There's no way for me to know what that is. And again, many of them don't even know what they're taking. So that brings back to us having responsibility of knowing what we're taking and being able to express that to our providers, all of the providers, not just if I'm going to see the psychiatrist, I'm not going to just talk about the psychiatric medication. I'm going to talk about what I take for blood pressure or what I take from over the counter, right? Even supplements. I want to know all of it because they can all counteract. And even with the food, I want to know, what do you eat every day? So I've had people like, I eat one grapefruit every single day. Well, grapefruit is one of the foods that interact with tons of medications. And they wonder why they're having side effects or the medication's not working. I'm like, well, we got to stop eating the grapefruit. I know you love it, but this, there's this happening, or some green vegetables, certain ones I have to say, I'm so sorry. I know you love that, but let's cut back on that because it's hindering the absorption of your current medication, or it's causing the medications to have issues binding or interacting with one another, or it increases potency. So these are conversations that you just have to have with the patient, but that patient or that individual just has to be transparent. Even things that you're taking recreationally.
Can be affecting.
Can affect everything, and it's sad sometimes when people don't share that information, but learn the hard way.
For sure. But I love like going into that of like how it all works together. So wellness, and like people think of one area like, oh, about medication, have the taboo, but it's like it all works together in our body. Like what we eat, how our mental health is, how our physical health, just like all of it together. So can you talk about, aside from medication, what are other things that someone can do to really create that like healthy wellness, and kind of, I'm not gonna say balance, but it's kind of like that unison synergy.
Yes. So from head to toe, I always say this. I'm like, wear sunglasses. Your eyes are well, let me just say this. Protect your eyes, okay? Wearing sunglasses. But also know that your eyes are the only window to your brain for light. So I want people to walk outside and allow light to help them.
Mm-hmm.
It also helps with making your mood better, alleviating depression and anxiety. Just sunlight, which is vitamin D to our skin as well. We need vitamin D if your vitamin D levels are low because we don't sunbathe, right? Because we're protecting ourselves from skin cancer, right? But knowing the vitamin D also helps with depression and anxiety. And if it's low, you're going to be depressed or anxious. So doing that, I also love acupuncture. You know, I encourage acupuncture for it helps you connect all the nerves and wake them up in different things, different channels in the body. It's really a Western style not Western, Eastern style of medicine that is underutilized for stress reduction. So encouraging that, massage therapy, different touch points. You know, most individuals have never touched their body from the top of their heads to the soles of their feet, and they don't realize that it releases different endorphins, different hormones of relaxation. So having a therapist come out and do those type of massages, you know, therapeutic massages are very helpful.
Yeah.
You know, go and see your dentist. The practice, people think like, this is so huge, but I'm like, no, your teeth. Your teeth are gateways to heart health. When our hearts are bad, mentally, we are also having issues, you know? So take care of your mouth, your gums, bringing inflammation down. The whole thing is about inflammation. Let's bring it down, you know? And then you start talking about physical health, getting your activity in, you know, your 30 to 45 minutes a day of physical activity, getting endorphins pumping in the body, moving. It clears your fogginess out of your mind, you know? Doing that and having a great dietitian or nutritionist to teach us how to eat so we can leave these overly processed, deficient foods alone. I like to say this to my patients. We are living beings. Why would we want to eat dead food? I'm like, they're like, what? I'm like, yeah, I'm not trying to tell you to go eat, you know, raw fish or chicken. What I'm saying is we want our food to be alive. We want it sparkling with nutrients and pumping our body with what it needs, right? Because when we start feeding it what it needs, what we don't need, we won't have cravings for anymore. You know? So leaving that stuff alone. It gets to be pretty interesting when we actually look at the bigger picture and we start to appreciate that there are access to other things, you know, flotation devices to help you relax. There is tons out there.
Which can be more like easy, practical. It doesn't have to be complicated.
No, journaling. Grab a piece of paper and write down what's on your mind. You will leave that piece of paper feeling 10 pounds lighter. You know, brain dump. If you have tons of ideas happening.
A lot, for sure.
I love brain dumping. Brain dumping is so much one of my favorite things to do that when I do it, I start laughing of the thoughts that I had, like random thoughts, and I'll post them on social media. You know, I do little things on my stories. I'm like, you know, these are thoughts that came to my mind. And it's just brain dumping. And can open up a door for amazing opportunities.
Yes, for sure. Because then you're like, wow, like that is, or even you find out things that like your fears or things that you're like, this is what it is. Like, you know, and even in my therapy sessions, I'm always just kind of like aware of that. Like what is kind of has been like my internal dialogue, you know, that can help by actually like you writing it on a piece of paper. But if you keep it on the inside, it's going to show up somewhere else. So it's not going to go away magically, you know, it's just going to get like deeper, like within ourselves.
Correct.
And I love how you share that because I feel like sometimes people make it very complex and make it like very like, oh, that's not possible for me. And it's like in the world that we live in, I feel like we are consumed by like social media and online and like Netflix and chill and all of that. But it's like sometimes when I start feeling a certain way, I start analyzing what is happening. Like what am I lacking? Have I not been active? Have I not been in community? Have I not been like, you know, what are like all my little pillars, you know, and to see like spiritually, like with God, like what is it, you know? And there are some times that you do need, you know, a little bit more and that's okay. So it's definitely a process with that. And I know you share a lot about like the mind as a garden and I kind of want to talk a little bit about that. Like, what does that look like?
Right. So the mind is a garden, right? There's so many beautiful things happening in the mind at all times. It's one of you never see a person walk around without a brain. right?
Yeah,
There's no brain transplants, right?
Yeah.
To date that we know
Yeah.
of, right? So why not think about it like this one organ that I have, it's full of beautiful flowers, it's full of beautiful ideas and beautiful things are happening all at once. That's why we brain dump, because some of those things can be really beautiful that can, sprout. But there are negative things that we take in, negative dialogue, negative thoughts that we have every day. And we have to catch ourselves and ask ourselves, where did that thought come from? Was that a seed somewhere? Maybe somebody said it, I accepted it, or I pushed it aside, and now it's trying to sprout because this area of my life is an area that I'm not so confident about. So when I say the mind is a garden, I'm encouraging you to take an internal perspective of what's going on in the mind.
Yeah.
What do we need to prune? Right? Maybe we have a thought that's just growing out of its sorts. It's just, leaning over. It needs you to prune it down.
Yeah.
So it can actually grow some fruit. What does it need to bear at this season in my life? Looking around and seeing there's weeds. When you have a garden, you see a bunch of weeds in there. You're like, oh, got to pull the weeds up. It's going to choke my tomatoes. Well, it's the same thing with the mind.
Yeah.
There's weeds happening in the fields of our mind. I need to uproot them. Do they serve me now? No, they don't. Do they protect me? No, they don't. So I need to uproot them, get rid of them.
Yeah.
Do I need to water something? Maybe something I thought of, right? Idea, or, or I want to write that book. Let's just use that. I want to write this book, and it's a seed in my mind. How do I start to write this book? Is by watering that seed. How does it look like to write a book?
Yeah.
What perspective do I want to come from? All of these things, like we start to really just start pruning, plucking away, watering, fertilizing, because by fertilizing, that means like go talk to an author.
Yeah.
How did they start writing their book? Take a writing class.
Yeah. Get inspiration.
Get inspiration. Get a Pinterest board. Whatever you need to do to fertilize that idea until it bears fruit, until you write chapter 1 through 6.
Yeah.
And you're like, man, I just wrote chapter 1 through 6.
Yeah.
And then like getting someone to protect that idea, maybe a mentor, right? Or maybe a writer coach, author coach, a publicist who can read your drafts and help you beef it up or get a different perspective. This is all part of gardening if you really think about it, and it inspires me every day when I think about different ideas that I have. And I always try to think about, is there something trying to choke that seed? Is it fear? Is it anxiety? Is it comparison? What is it? And I try to uproot it as best as I can. And I tell somebody trusted and who's near and dear to me. And I'm like, hey, this is the idea that I have. And I'm not asking for your opinion. I'm asking you to keep me accountable. Yeah. And maybe even if you hear of different resources, point me in that direction.
Yeah, for sure. Yeah. And that's so important. That reminds me of cultivating. I'm huge with like that word cultivate, because I feel like it's like that process, and it's like the more time you're spending, it gets deeper, and it can you can see the benefits of what you put into it, and what you consume your mind upon will grow, and so good and bad. Yeah. And so I love that you shared that. And I know that this has educated someone today. I've learned a lot, from today's conversation. Awesome. And I know there's just a brief interview of like you, a little bit about what the work that you do, but do you want to leave us with just some encouragement of like our mental health and our mind for someone listening?
I would love to. My mentor, Dr. Cindy Trim, whom I absolutely adore and admire, she said something to me, and she often says this, and she says, your feet will never take you to a place that your mind has not been. So if your mind has been in a place of, I want to get help, I want to be healthy, I want to be strong, that's where your feet is going to take you. You're going to take the next steps. That's part of that cultivating. You're going to take the next steps to get where you want to go. If you want to get healthy, you're going to take the next step of getting up the next day and going for a walk, or changing your diet. Or if you want to get mentally strong, you're going to take the next step to get evaluated by a therapist. If you feel like, okay, I've already done that, what's the next step? You're going to schedule to see a psychiatric mental health provider to get what you need. It's all about getting what you need, right, through this process and this journey in life. Yeah. And the only way to get what you need is to think about it. And your feet's going to take you there.
Yeah, that's so good. I love that. Thank you for sharing
You're
with us
welcome.
today. And how can people connect with you and get in contact?
Oh, of course. Vividmindscare.com for the practice. If they want to follow me, social media is at Dr.Marcelline Girlie on social media, like your Instagram and stuff like that, and the practice as well. My personal website is marcelinegirlie.com. So feel free to connect. I am always open to talking and chatting with people.
I
People.
love it.
Yes.
Yes. And honestly, you have to follow her on social media. She shares a lot of gems and just
Thanks.
consistent encouragement as well. So I will put all her information down in the show notes. I appreciate you taking the time
Thanks for
of
having me.
your week and your knowledge and sharing with us today. And for you guys listening, I hope that this encouraged you, gave you kind of an inside perspective of maybe a different part of mental health and the help that's available to you, as well as to know that we are all a work in progress. As even I loved how she shared today of just even her own struggles, as a mental health provider that you help other people. Sometimes we think that we have to have it all together and all of that. And that's not the reality, And so I will put all the show notes of other episodes as well about your mental health and just how to cultivate help and just bring that awareness. I feel like that awareness of sitting with yourself and kind of figuring out what you need is so vital to the change that you want to see in your life. And so if this episode helped you today, make sure to share it with a friend, tag us on social media, and just know that you are not alone. Your mental health matters and you matter as well. So I will see you guys next week.